Hi, I'm Menaka Raman-Wilms, and you're listening to The Decibel from the Globe and Mail. Today on the show, I'm talking to Dr. Bonnie Henry, British Columbia's provincial health officer. We get into why BC is keeping vaccine passports, the future of the pandemic, and the difficulties of being the face of public health decisions. This is The Decibel. Dr. Henry, thank you so much for being here today.
Well, thank you for having me.
At this point in the pandemic, almost 2 years in now, we've gone through a few different waves. BC this week, though, just lifted a good number of COVID-19 restrictions, including capacity limits at gyms and restaurants. Dancing is even back at nightclubs. But people will, of course, still need to show their proof of vaccination in many places. Why did you decide to keep the vaccine passport in place?
Well, that was a measure that we took quite early on, and it was a way of building people's confidence and mitigating risks. So there's a couple of reasons for the BC vaccine card. What we needed to do in the summer of 2021, when we started to see increased transmission again, particularly around Delta, and very importantly, we were at a point where everybody had access to vaccine. We very specifically chose those indoor environments that were higher risk for transmission. So restaurants and nightclubs and events where people were coming together indoors, recognizing that that was where it could transmit more readily. And having people who were only vaccinated in those settings reduced the risk. It didn't make it zero, but it reduced it quite a lot. And the second part was to incentivize people to get vaccinated, and it made a difference in a certain population. It was always intended to be a temporary measure until we reached a certain point in the population, and I put the expiry date on January 31st, and we were on track to get there when we were getting through the Delta wave, but then Omicron hit. And of course, things changed a lot with Omicron, but it is still an important measure.
Yeah, the incentivization of the card or the passport, as it's sometimes referred to, is an argument that a lot of provinces made to get people vaccinated. But the difference with BC's approach now is a little bit different to a lot of other provinces, because other provinces are canceling or have announced a date to cancel the vaccine passport or card. So Ontario, Quebec, Manitoba, Saskatchewan, Alberta have all kind of made an announcement with this in mind. Mm-hmm. What's the difference here then? How are other provinces coming to a different decision on this point than the decision you're making for BC right now?
Yeah, so our decision is based on public health advice, and it's based on where those limited. So if you think of Quebec, for example, they were using their vaccine card in a whole bunch of different places that we're not. The other thing that's really different that we've done here in BC is we have a COVID safety plans that are very specific to every sector and every industry. So those go hand in hand with having only vaccinated people, with mask wearing, with having safety plans that mean that people don't crowd in certain places. So in a sports arena, when you're entering and leaving, for example, there's plans for managing lineups at the concession stands or at bathrooms, because those are the areas where we were seeing that transmission could happen. So it is all part of our strategy that has worked really well for us and has meant we have not had to close down most businesses. We've kept things open through the whole time. We've kept children in schools. Schools went back in June of 2020, and they have remained in class learning throughout the whole time. These are important strategies that we used, and the BC vaccine card still has a place in that. I do see it as not being permanent. And as transmission comes down in our community, especially right now, we have very high levels of community immunity because so many people have been vaccinated. So over the next few months, we'll be looking to removing mask mandates, no longer needing to use the BC vaccine card right now because rates of transmission are low. So that risk, even in those highest risk settings, goes down. I think we're in a place where we have enough community immunity, and we have enough common experience of how to deal with this virus. We have treatment options in place. We're going to have another vaccine option, hopefully within the next few days as well, that I think is really important.
Which vaccine is that?
Novavax. So one of the protein subunit vaccines is under review by Health Canada. The other one's Medicago, also a protein subunit vaccine, a more traditional vaccine that I think will be a really important option for a lot of people who have really made up their mind about mRNA vaccines. These ones enable them to get that protection without having to get an mRNA vaccine.
I want to ask a couple of questions about your role in this point in time, Dr. Henry. Before the pandemic, most Canadians honestly probably didn't know the name of their public health officers. And since then, you've become a household name in BC, but in Canada as well. And your job has become much more public. Has the pandemic changed the way that you think about your job or the way that even you do your job?
It's always been, here in BC anyway, an independent role providing advice to government, and very importantly, a legislated independent role. Building trust with government has been a really important part of my role. And what I've seen is that that level of trust that we've built with many different ministries has also means that I can move ahead some of the other important issues. And one of the biggest ones that we're dealing with, of course, out here is the toxic drug crises. I see it as a really important transition to support public health, because it's very easy. And we saw this after SARS, we saw this after the pandemic in 2009, we see it after every major crisis, that the prevention role and the safety net that is public health gets whittled away. It's easy to stop these programs when you have the tyranny of the urgent, as my predecessor used to call it. I think the recognition of the role that public health has played, and I've been, in some ways, the voice in the face of that, but there are a whole team of people. Mm-hmm.
Dr. Henry, this role, it's a very public-facing role, and as we've seen, especially in recent weeks with everything that's going on with the protests in Ottawa and the border blockades, tensions are really high in Canada right now and all over the world. Can I just ask about the response to how people look at you and your role and what you hear?
Yeah, it's been particularly challenging, as you say, in this last few weeks, because there's been I've had, unfortunately, some death threats that started very early on in January of 2020, when we had our first press briefings about this. But it's been sort of goes in waves, and it got really bad during the federal election. There seemed to be, for some reason, people felt emboldened to be able to say things specifically. And I have an RCMP protection detail that's with me all the time. And the last few weeks has been particularly difficult. But specific things like, I have a gun, I'm going to shoot you in the head. God. I'm paraphrasing, but it's very disturbing, and it's very frightening in some ways, and it makes it a challenge when you're subjected to this ongoing vitriol. And people hide behind the anonymity of social media, of being able to send things electronically, and you don't actually have to face somebody. This underlying minority of people who can be really disruptive and angry and threatening. Can I ask how do you deal with that? Sometimes it's really challenging. I don't sleep very well. I worry. I have a very close family and friends that I talk to who help me. I've actually had to leave my house sometimes for a period of time, so that for your own protection, safety. My own safety. That's one of the things that I hope will stop at some point in all of this. Physically, it takes a toll on you, physically, mentally, emotionally. It absolutely does. And I do meditate. I write a little bit, some of the things that I'm feeling, and I have strong support from from a few key people, and that makes a big difference. And, my one of the advantages of my RCMP team means I can go running now. And keeps them fit too.
I guess you wouldn't be able to without that kind of protection.
No, and it was realizing, and some of my team had realized that people were following me when I was running by myself. And
that's scary. That's very scary.
At one of the protests very recently, they had signs that had my address, my home address, and were encouraging people to come to my house. So, though it is scary, and it's really, it's inappropriate, I think, to be targeted for doing your job the best that you can.
Yeah. I'm sorry to hear that. That's a lot to take, and it's a lot to have to deal with on top of just doing your job, which is already high pressure.
Thank you.
To look at BC's response, as you mentioned, relatively speaking, compared to other parts of the country, BC has remained relatively open throughout the pandemic, right, where a lot of other provinces have had to close down periodically. Especially since people are used to this kind of freedom, I guess. There's this question about the public's appetite for mandates and for lockdowns. How much does the idea of the public's appetite or lack thereof for like more severe restrictions after they've had some freedom, how much does that kind of play into the way that you make these decisions now?
Yeah, I think we're all tired of it, aren't we? So very early on, we tried to tailor things. And as I mentioned, that we have our COVID safety plans. From the very beginning, I've always said, go outside. We've never had this, you have to stay at home. You can't go out except for essential things. We've never shut down businesses, except for whatever essential businesses are, because we recognize that so much of it is related. There's so much connectedness, and that people are differentially affected. And we've seen the inequities that have been exposed. If you work in a poultry processing plant, you don't have sick leave, and you have this need to go into work, or else you don't get paid. And so we addressed many of those things directly with the industries where we were seeing issues. We had COVID safety plans in the food processing plants that reduced illness dramatically, and then we prioritized those workers for vaccination. We have very high vaccination rates. So that type of support for different, especially worker groups, meant that we didn't have to shut down businesses. We've never had a lockdown here in the same sense that we've had in other places. I think because so many people have stepped up and been vaccinated, we try and temper that, because that is an important factor that helps us understand risk in different settings.
Mm-hmm. There has been a little bit of criticism, though, of the way that BC has handled it, in the sense that sometimes people do want maybe stricter rules to know what they can or cannot do. Is it safe to go here? Is it safe to go there? Do you ever regret not putting stricter restrictions in place?
Not at all. I think some of the things that, our bent is always, we've talked about this many times, it's what we call least restrictive means to accomplish the aim. So what I try and do is put in place the things that need to be there to prevent transmission. But yes, there are some things that we've put in place that I was equivocal about at first, things like mask mandates for young children in schools. Mm-hmm. We thought last summer, in the summer of 2021, that we were in a really good place with immunization and that we could move back a lot of the restrictions that we had in place and put in place guidelines rather than public health orders. And that worked for a little while, and then we started to see cases going up again, particularly in the interior, and we had to go back to orders. And the mask mandate was one of them. And it really was recognition that a lot more people were comfortable with it, and it made it easier. Businesses told me that it made it a lot easier for them if it was clear that it was a mandate and they could blame it on me and it supported their staff. So, I'm fine with that. As much as, technically I would like it to be guidance that people follow. the recognition that it was making it challenging for businesses and especially like grocery stores and places. And if it supported them, then we did that. So it was a lot of understanding where we needed to do that and responding to the situations we were seeing on the ground.
Looking forward now, I guess, to this upcoming year, I wonder what you think of what the end of the pandemic looks like. Is that even a thing? Can we talk about the end of the pandemic?
I think we can. I think the pandemic will end. But this virus is going to be with us as a serious respiratory illness for some time. And I've said we at least need to, and I kind of see it as oscillations, and it's going to have peaks and troughs over the next number of years. And so I definitely think we're going to be living with this virus, and we need to be able to adapt.
Can I just ask, what does that look like? What does adapting to this virus mean?
So living with this virus, adapting to it, means that we have a better understanding of when it's going to affect people more. So we know that for influenza, and we can prepare ourselves for that. We get vaccinated every year for influenza. So we don't yet know all of those parameters for COVID, but we know it's going to be around. It's going to affect some people more than others, and we need to understand how, if we're not in that high risk group, how we manage it ourselves. We stay home when we're sick. We wash our hands. We wear masks in certain situations. So knowing how we can live with this virus as another one of those serious respiratory illnesses. On a broader sense, when we get out of this pandemic, there's a whole lot of mental, physical, emotional pieces that have happened to us. We need to recognize that we have suffered and people have sacrificed through this in a whole bunch of ways. So we need to build back the economic side of things too. And we need to pay attention to what is it that we do that helps people bounce back, that resiliency. If we help each other through this, and we don't get angry at each other all the time, and we don't come from a place of penalties, and we will bounce back better. And that's the type of thing that we need to pay attention to now, and we need to start working on.
The sense of community is interesting because I think, especially at the beginning of the pandemic, this was something we talked about a lot. It's interesting now, though, because with these kind of loosening of restrictions, it's almost like people who are vulnerable are being told to, take more precautions because they are more vulnerable. And other people are starting to, I guess, kind of go back to a bit of a more normal reality. Isn't this kind of creating a division between people, though, that we're telling the vulnerable to take care of themselves and essentially kind of leaving them to do that?
Yeah, so I think here anyway, what we're trying to say is we all have people in our families, our social connections, our work connections who may be in that group, and we may not know that. So we all need to collectively continue to do those things. We do those things individually, and we may do more or less of it individually, depending on our own vulnerabilities. But we also need to understand that some of the things that we have done collectively continue to be important. And that we have to pay attention to that. So that's why we have these transition plans. That's why we still say it's important to wear masks still right now. It's important to be vaccinated still right now, because it's going to make a difference to the people in your family, in your community, and the people you don't know next year.
And do you think when you say the end of the pandemic, is this 2022? Is this something we can expect this year? Do you have a sense of that?
I think globally, probably not until 2023 at least, just given what we're seeing in terms of immunity and vaccination and access in different parts of the world. Maybe by the end of this year. We're doing better at that now, and now that more vaccines are coming online. I think we're in a little bit of a really tough place right now in the next few months, because there is still this evolutionary pressure on this virus. Mm-hmm. And there's a lot of pressure right now for a mutation to arise that is more transmissible, hard to believe, but also potentially able to evade the immune system and cause more severe illness. And because the more severe your illness is, the more likely you are to shed more virus for a longer period of time and pass it on to others. So there's that little bit of the window's closing as we have more and more immunity that prevents severe illness and prevents people from shedding a whole lot of virus. But I think we're still in a really tricky place, at least when I listen to the evolutionary biologists who talk about this.
On a totally separate note, Dr. Henry, we're just seeing reports that Novavax has been approved for use in Canada.
Good. I knew it was coming soon. That's very good news. I mean, I think this just gives, I think, the mRNA vaccines are amazing. And I have full confidence in them. The technology's been in development for a long time, and they work really well. And I think they're going to revolutionize vaccines for influenza, hopefully for HIV, which is something that's been elusive for a long time. But, having alternatives for people, particularly for people who have real concerns or who've had a reaction to mRNA vaccines, is also really important. And that's one of the things that we are going to get out of this pandemic because we have that definitive tool of vaccination that is effective and works and protects people. And this is another one that can make a big difference for people.
Dr. Henry, it's been really great to hear from you. Thank you for taking the time today.
Well, thank you very much for having me.
That's it for today. I'm Menaka Raman-Wilms. Our producers are Madeline White and Cheryl Sutherland. David Crosby edits the show. Kasia Mihailovich is our senior producer, and Angela Pacenza is our executive editor. Thanks to the Globe's Western Bureau for their help with this interview. If you liked it, and if you like the show, please tell a friend or leave us a review on Apple Podcasts. Thanks so much for listening, and I'll talk to you next week.